Well, thank you very much. It is a pleasure to be here today, and I'm not Neil Betteridge, as my name tag says. My name is Federico Moscogiuri. I'm the head of policy and campaigns at Arthritis Care. And I'm just going to start with a few quick words about Arthritis Care for those of you who might not be very familiar with us. We are the UK's largest organisation working with and for all people with arthritis. So what I'm going to talk about applies to people with RA, but is not specific to RA. We are a user-led organisation, and user involvement runs at the heart of what we do, which means that people with arthritis input into the workings of the organisation at every level. We have a high percentage of staff with arthritis, and a lot of our board is drawn directly from our branches, made up of people with arthritis. Empowerment is also a key part of what we do. We do that in many ways, partly through our self-management package, partly through our campaigns and our influencing. And we give people with arthritis a voice, whether that's by channeling their concerns or giving them the confidence to play an active part in making things better for all people with arthritis in a very general sense. There's been a lot of talk and increasing amount of emphasis on patient and public involvement in the NHS, particularly since the Darcy Review. World-class commissioning requires commissioners to engage with service users. The NHS Constitution, as we know, gives the right to patients to be involved and to be informed of the ways in which they can be involved and have a say. And we've also seen developments such as the recent Patient and Public Engagement Support Programme, which aims to positively engage and empower service users and use patient experience to improve service quality. So clearly, the NHS is reorienting itself to deliver high-quality and inclusive services based around patient experience, which genuinely meet people's needs. And part of that, I think, is based on a growing recognition that patients are best placed to know how their condition affects them and therefore what they need from the health service. So all the signs are actually very encouraging for a more patient-focused, inclusive health service. But as we know, getting there is difficult, and we know that at the moment the success, the quality of engagement across the NHS is very patchy, and my colleague Jenny Snell has already touched on some of those points and the obstacles that are faced. World-class commissioning shows that engagement at the moment is actually far from world-class, scoring an average of 1.6 out of a possible 4 in recent assessments. A recent Healthcare Commission report has showed that people don't feel that they still have enough of a say in services which affect them. So clearly reality is struggling to live up to the rhetoric, and there was a clear need for better, more proactive involvement of patients and service users. And I say involvement rather than engagement because even though the two words are often used interchangeably, there is a risk, I feel, that sometimes in talking about engagement, we might look at that as effectively making contact with patients as opposed to involvement, which implies a more participative, ongoing relationship, which I think is what we need to aim for. And that brings me on to what I mainly want to talk to you about today, which is Arthritis Care's program of involving users as experts. This was a series of courses with DH funding, which Arthritis Care ran from September 2007 to September this year, aimed at empowering people with arthritis and other musculoskeletal conditions to feel that they can really be involved in the design and delivery of services which affect them. The courses themselves were 2-day residential courses. We ran a total of 5 courses, 3 in 2007, 2 quite recently in June and July. The last 2 we ran together with PCTs, 1 in West Kent and 1 with Leeds and Wakefield PCTs. And the whole focus of this program is to empower people in two ways, mainly through knowledge and confidence building, with the latter being particularly important. In terms of building up knowledge, the course was designed to give people a better understanding of policies related to arthritis and MSK conditions, musculoskeletal conditions, how local health organizations operate, NHS language and procedures. In terms of confidence building, the courses aim to develop people's skills in recognizing and articulating views and knowledge, working as part of a team, representing others, consulting others, and being effective in meetings. The courses included between 10 and 18 participants who worked both in groups, in pairs, and they were designed to be as varied and inclusive as possible, so there was some role play involved. They did presentations, all of this in a safe and secure environment. The course itself has been subjected to independent evaluation, and these are some of the key findings. First of all, there was very positive feedback from the participants. 73% described it as very helpful, and the rest described it as helpful. The main words that they used to describe it were motivating, valuable, stimulating. And it did demonstrate its ability to actually empower people in a practical way, because we know that quite a few of previous course participants went on to be involved with the health service in a range of ways, from joining the local link, joining a PCT musculoskeletal pathway development team, becoming members of clinical governance committees, or even helping to plan a new rheumatology unit. From the perspective of the PCTs that worked with us, they said they found it very helpful. They thought the content facilitation was good. They appreciated the chance to input into the development of these courses. They, while appreciating the benefits of the residential aspect of the course in terms of helping participants to bond and forge a cohesive unit, they were a bit concerned about the cost. And it is true that the residential aspect of the course, the way these courses were run, was a significant cost as part of the whole thing. They expressed an interest in broadening the scope because clearly these were run aimed at people with arthritis and musculoskeletal conditions, but there's no reason why they can't be expanded to a broader range of patients and service users. And they also emphasized the importance of having clear structures and support to sustain involvement for people who take part in these courses. So what is the added value of involving users as experts? What makes this model special? How is it different from any other model that is currently out there? Well, in addition to its particular blend of knowledge and confidence building, as I mentioned before, it offers PCTs the opportunity to achieve targeted, high-quality engagement with expert individuals who have been trained and are capable of representing not just their own interests as service users, but those of a much wider group of patients and members of the public. These are involved and committed individuals who, having been on the course, understand the NHS, understand their role in it, and they are prepared and committed to engaging the health services in a constructive dialogue, which will ultimately result in better services for service users and a more genuine and productive relationship between service users and service providers. The emphasis here is on quality as opposed to quantity of engagement. It's not enough to take a representative sample of people with arthritis and ask them how musculoskeletal services need to change, because it's unlikely that those people will be fully equipped to engage fully with that process. It's unlikely that the picture that emerges will be truly representative of the needs of all people with musculoskeletal conditions. So there is a risk that engagement in that respect becomes mainly a box-ticking exercise, whereas involving users as experts is specifically designed to achieve high-quality engagement with expert individuals who have been trained up, enabling both service users and service providers to have that positive and productive relationship.